This is Dr. Reetu Mukherji from the Rush Center for the Cure of GI Cancers. And this week, I wanted to highlight a study that was presented about a week ago at a conference, AACR 2026, that looked at the role of personalized mRNA vaccines in pancreas cancer. And I chose this study because it's gained a lot of attention in the media and generated a lot of questions amongst my own patients in the last 1 to 2 weeks. So by way of background, today for resectable early stage pancreas cancer, the standard of care for most patients is surgery up front, followed by about 6 months of chemotherapy, with the goal of eradicating any microscopic residual disease that surgery unfortunately was not able to remove. But with this approach, many patients still unfortunately will eventually develop cancer relapse due to the presence of this microscopic disease. So many investigators are designing strategies to try to better eradicate microscopic residual disease and improve the rates of cure. This study was a phase 1 study that was conducted and led by Dr. Vinod Balachandran, an investigator at Memorial Sloan Kettering in New York, and in collaboration with the company BioNTech and Genentech. And essentially what they did is they enrolled patients who had early stage pancreas cancer and underwent surgery. And they still treated them with chemotherapy after surgery, but also with a personalized mRNA vaccine and immunotherapy. And the vaccine was essentially designed to recognize proteins and what we call antigens in a patient's tumor. And when delivered to a patient, it is designed to train the immune system to mount an immune response and recognize microscopic cells to try to attack and eradicate. And the goal of this study was to look to see if this strategy could elicit immune responses. And it was a small study, 16 patients, and they all treated the patients after surgery with chemotherapy, the mRNA vaccine, and immunotherapy. What we learned is that with the vaccine strategy, about 50% of patients, or 8 out of 16 patients, actually did mount an immune response based on the vaccine. And this, with longer follow-up, over 5-year follow-up now, was found to be durable. And what we also found was that those patients who elicited a response, so of those 50% of patients, almost 90% of them, or 7 out of 8 patients, were alive at 5 years. And this is in contrast to only about 25% of patients being alive amongst the group that did not elicit an immune response. So we've learned that this mRNA vaccine can elicit immune responses, and those that elicit responses tend to live longer. Very promising results utilizing the strategy, but it's important to remember that this is a small study of just 16 patients, and certainly these findings need to be further studied in larger studies which are underway. And eventually, and this is already ongoing, we need to compare this strategy to our current standard of care today to truly understand if patients will live longer with this type of approach. So very exciting news, promising strategy. It is not something that we will yet see implemented on the day-to-day in the clinic, still under a research avenue, but we look forward to more data from strategies like this and many other vaccine strategies in pancreas cancer and across other GI tumors coming in the future. Thank you.